Good morning. Good morning. Good morning, brothers and sisters. Welcome to the last day. We're in the home stretch. And if you want to make your planes, we're all going to work together and make this thing come together. Today is really, we're going to try to really bring this, what we've done all weekend, we're going to try to bring it together. And we have picked the perfect person to do that, my good friend and comrade and sister, Rita Valente, is going to lead today's discussion. And before I introduce Rita, I just want to say a few acknowledgments. Unite Here, Local 8, members are working on your food service this morning. And operating engineers, Local 701, are making sure that the climate is properly controlled in this room. So don't forget the operating engineers. And by the way, the staff at the Elliott Center that we were at the last 2 days are represented by the Communication Workers of America. So they're also a union facility. And while we're talking about workers, I just want to give a shout out to the brave GM workers who are now struggling with, decisions on where to go next. So, they've spent a hard month on the picket line, and let's shout out to those brothers and sisters. And the amazing Chicago teachers who are fighting for the future of all working people in Chicago. Labor is on the move. And Rita has been a part of that her whole life. She's been a registered nurse for 36 years. She's based in Atlanta, Georgia. Long-time social movement activist, a long history, and is one of the OG members of Healthcare Now. She was a good friend of Marilyn Clement, the founder of Healthcare Now, and has, I believe, served on its board since the very beginning. We're going to set the tone this morning, and then Rita's going to lead you through a whole kind of participatory project here that will help us take some real lessons back home with us. So without any other ado, I'm going to turn it over to Rita Valente. Thank you.
Good morning, everybody. How's everybody? Good. I'm going to do something that I wasn't supposed to do, but I'm going to do it anyway. Before you stay right. Before I introduce this amazing human being, Darius Gordon, I want everybody to recognize and appreciate Ben Day. Ben, where are you? Stephanie Nikima. Stephanie. Mark Dudzik. And I'm only doing this now because I know folks may have to, jump on planes and do whatever, and I want to make sure they feel all the love that we actually have for them. One other thing I want to do, I'd like everybody that organized or put together a workshop or whatever to stand up and give yourself a round of applause. You're moving us forward. I love it. I love it. I love it. Okay, well, I have the distinct pleasure and had the distinct pleasure of working a little bit with Darius recently on one of the workshops. Darius Khalil Gordon is the national field organizer for the Center for Popular Democracy, and he promises to talk a little more about that. He's part of the Fight Back initiative, and Darius is bringing his energy and years of experience as the lead organizer for Citizen Action of New York and national organizer for the Gathering for Justice to this table, okay? Darius first came to New York to serve as an African-American and youth director for a state assembly campaign. When the campaign ended, he began work with the Working Families Canvassing and Fundraising Team, where he expanded his knowledge and practical skills for electoral and social justice work. In early 2014, Darius started as a community organizer for Citizen Action of New York, working on and winning campaigns such as the Fight for 15, paid sick leave, and paid family leave. He has also had victories, and these are very special and important victories, in the criminal justice field, being a member of the Justice League of New York City, where they helped get raise the age legislation passed in the New York State Legislature, making it now illegal to house 16 and 17-year-olds in adult jail and prison facilities, all right? And I do have to say one other thing here. We're kind of proud in Atlanta. Women on the Rise in Atlanta got our jail closed, okay? So, and a number of other groups, Song, a whole bunch of us, okay? He is a Washington, D.C. native who studied African and African-American studies at Penn State University. Please show your love and appreciation for Darius Gordon.
Thank you so much. I really appreciate that. I'm a little tall, so I'm going to hold the mic in my hand. Yeah, nobody noticed, yeah. Good morning, everybody. Good morning. It's such a pleasure and honor to be able to talk to you all this morning. In all of my years organizing, I never would have thought my first keynote ever would be on healthcare, but truly honored and blessed to be here with you all today. A little louder? Okay. Oh, okay, the mic actually does work. I thought the mic was not working. Okay, great. We are in a time like no other, and we have an opportunity to make substantial change, some real change. It's so fascinating to think how much healthcare is rooted in our American life, how much damage the generations before us created, and the effects that are still around today. We are at a time like no other, where if we don't take the proper steps, we can set future generations into a deeper spiral than the one that we are already in. I do, however, want to leave you all this morning feeling inspired and motivated about a future in which there are enough resources for everyone to live safe, healthy, and fulfilling lives. And that healthcare especially is distributed by patient need, not by how much money is in their bank account. I know the people here are some of the most committed organizers to Medicare for All in the country. And we all come here to this conference to think about the work and what we can take home to make better, stronger, more impactful experiences so that we can actually win healthcare for everybody in this country. I truly believe that in order to do the work well, in order to do it in a way that we all will win, we must first go back. There is a Ghanaian word, Sankofa, which translates as, "It is not wrong to go back for that which you have forgotten." I will repeat that. It is not wrong to go back for that which you have forgotten. So in order to get a better sense of the climate that we are in, like how did we get in this mess in the first place? Let's go back, because so much of the work that we do today is informed by the legacy of our past. And we definitely left something, someone, and some people behind. Usually when we talk about healthcare, a lot of people who look like me are not in this room. For the longest time, when it comes to issues like healthcare, climate justice, money over profit, we tend to think of these spaces as predominantly white areas. Makes a lot of sense when you think about it. For the most part, people who have time and resources to volunteer or think about life outside of their everyday struggles don't look like me. We are often seen as a checkbox to mark in progressive spaces. But if we want to win Medicare for all and so much more, this mindset must change. People of color, women, people with disabilities, the LGBTQ community, and people who are most impacted by the failures of our healthcare system really have the most to say about how to change it. And when movement is centered around people with the most experience, amazing things can happen. It is a necessary component of building multiracial democratic movement that can win things like Medicare for all and so much more. Historically, when it comes to the needs of the Black community, we often feel like an afterthought. Only when election season approaches are we thought of and pandered to for a vote. But as quickly as they come, as soon as the candidate wins their seat, how quickly amnesia sets in. Far too often when it comes to the issues that are seen through a racial justice lens, we limit issues to gentrification, the state of policing in this country, rap music, or the negative effects that violent video games have on us, as if healthcare, clean air, and a livable planet isn't something that we all need. You would think, given the fact that we are in 2019 and how advanced technology is and information literally at our fingertips with our cell phones, our silos would not be so separated. Yet, when it comes to healthcare and other issues like it, the question remains, why are we often seen on the outside of the movement rather than in it? Now let's go back to some hard history a little bit after the Civil War. Did you know that this was the first time that free healthcare system was attempted in the United States? At the time, free health services were delivered to Black communities through the Freedmen's Health Bureau. They attempted to provide healthcare to millions of formerly enslaved people. This program of free healthcare had been set up mostly to make sure that white folks didn't get sick and that they were severely underfunded and understaffed. They didn't last. But I think it's important to start history in this perspective to give us a way into the future. Nearly a century goes by before another major attempt is made to address lack of healthcare access in response to the civil rights movement. While other countries were busy establishing universal healthcare systems with social insurance model, the U.S. opted to implement two separate public programs, we all know, Medicare and Medicaid, one for seniors and one for states to administer to low-income people. These separate programs attempted to address the problem, but they continue to maintain a tiered and segregated healthcare system to this day. There were continued efforts to improve upon this tiered system, most recently with the Affordable Care Act. And we saw it by that time, the power of the private health insurance industry made sure nothing like Medicare for all was even on the table. And even with efforts to continue to improve access to care, there's still a strong distrust for the healthcare system in communities of color, particularly the Black community. Now, I'm going to give you some information that might explain this a little bit. So, according to the Journal of the National Medical Association's think piece, An American Health Dilemma, this was published in 1992, it states, increasing awareness of this crisis is evidenced by the racial discrepancy of Blacks living 5 to 7 years less than whites, experiencing access to cancer incidents, morbidity, and mortality rates, suffering almost half the nation's maternal deaths, experiencing infant mortality rates as high as underdeveloped countries, and suffering more than 60,000 access deaths annually. Tens of thousands of access deaths. Imagine if these people were here, living their lives, supporting their families, communities, even voting. These figures and quotes are from 1992. That's 27 years ago. Do you think those stats are different today? Well, I have those facts for you today as well. According to the U.S. Department of Health and Human Services in 2017, African Americans have 2.2 times the infant mortality rates as non-Hispanic whites. African American infants are 3.2 times as likely to die from complications related to low birth rate as compared to non-Hispanic white infants. It's so heavy to think that thousands of people who look like me are not here today because of the history of racism in this country that has shaped policies and hurt people. And even to this day, these issues plague our whole society. Our movement for Medicare for all must truly understand this pain if we are ever to win. When we have a system that provides healthcare based on status, wealth, and race in this country, as opposed to need, these are the shameful results that we are left with. Your zip code can actually predict your life expectancy in this country. It is not public program. It's not because public programs didn't work. It's because they lack resources and funding, leading to programs that are often slow, help very little, and have staff burnout due to scarcity of resources. All of this creates a narrative that public programs don't work. And who benefits from that narrative? Nobody, especially not us. Not to mention institutions like the AMA, the American Association of Medical Colleges, the Catholic Hospital Association, the Protestant Hospital Association, and others allowed its members to continue to racially segregate in areas with widespread prejudice, even after legislation like the Civil Rights Act was passed. The race and class battle for control was and is real, and is still being fought out today. We see a lot of rural America voting against its interests because of party lines and ways that they identify themselves. There are many more social and economic reasons why healthcare was not given to all, and I can spend a session on this alone. But just don't take my word for it. We at the Center for Popular Democracy work with 55 affiliates in 35 states, including Puerto Rico and Washington, D.C. Is Sophia here today? Oh, there's Sophia. Sophia Sepulveda, who is our healthcare organizer for Texas Organizing Project, has done an amazing job. Not only are they able to increase the grassroots numbers who support Medicare for All, but through coalition efforts with DSA and the National Nurses Union, we're able to get a high ranking of Congress, Lloyd Doggett, to sign on in support for Medicare for All. She, however, states there are still problems she deals with in her everyday as she organizes for healthcare. She states there are still racial biases with white practitioners towards communities of color. They have the idea that black and brown folks have a higher tolerance than pain, which is not true. And we see that in the higher number of maternal mortality rates in black women. Doctors tend to ignore our pain and let us go home. They also believe that we have a more addictive personality, which prevents doctors from giving us pain management medications. Immigrants, black people, and brown folks are unable to qualify for Medicaid and are many times unable to access life-saving treatments such as dialysis due to being unaffordable, and our community suffers in the end. Insurance companies not only charge monthly premiums, some of them ask you for a copay just to see a doctor. It could range from $5 to $25, which is also a burden with our members in our community. And representatives keep adding restrictions like access to abortion. In the South, you have to reapply for Medicaid or CHIP every 6 months. People with HIV have to reapply for medications every 6 months. Can you feel the suffocation? Can you feel your head being submerged underwater with 50-pound weights on each ankle and nowhere to go? This is the reality that some of us live in. Now we've heard a little bit about the history of this issue and how it affects our organizing today. The base is set for us to grow and build together. We at the Center for Popular Democracy care very deeply about healthcare. I'm sure all of you here are very familiar with the work of our colleague and friend Audie Barkin and the Be a Hero Fund. Audie is currently dying of ALS, but chooses to spend his time and energy making sure that you and I are left with something more, even if he won't be around to see it. Audie once said, "I'm willing to give my last breath to save our democracy." What are you willing to give? Inspired by this movement, I want to share with you some great work that our other affiliates are doing to really bring change in their communities that will carry over this entire country. Spaces in Action in Washington, D.C. have had a number of teach-ins where they focus on local policies that can change and help with everyday issues, such as the Healthy Beverage Choices Act of 2019. I encourage everybody to Google that, the Healthy Beverage Choices Act of 2019. Issues like these bring people in the room because they can relate. This leads to their members wanting to support causes like this and other pieces of legislation like Medicare for All, because now they can see how they all relate to one another. They lead with the emphasis on taking care of the now in order to see a future for tomorrow. Delaware Alliance Community for Advancement's director, Carrie Evelyn Harris, has similar solutions, constantly asking the question, how can we talk about healthcare, Medicare for All, with honest and digestible answers? And how does every person see themselves in this fight? A real focus on education needs to happen in order for people to get up and do something about the current situation. To sum this up, the solutions are not difficult as one may think, but the practice is in perfecting it. This is the next civil rights movement, you all. We must first realize that we are not a first-class nation if the majority of the people here have second-class health care or none at all. We must fully embrace the fact that and the understanding that communities of color have always been knowledgeable when it comes to their bodies and what they need. More black and brown doctors and nurses need to be at the decision-making table. They have the knowledge and experience to fix a lot of the systemic problems in this country. As long as we have a tier system, healthcare will be worse for everyone. These examples show that we must share our stories with each other, with people who look and don't look like us. There must be a focus on our white friends, allies, and accomplices to really listen. When it comes to this issue, I know we have a lot more in common than not. And when we get together and share our experiences, we can be so much more powerful together. The beauty of the Medicare for All bill is that it rejects the need for tiered and segregated health care. Everyone gets the same card, the same benefits. And if we make sure it works as planned, the same access to high-quality health care that we can actually afford. Medicare for All would help heal some of the very difficult history that we all experience, and it still persists today. And a movement that truly embraces this principle is a movement that will win. So I have to say, I misspoke earlier in the speech when I said we are in a time like no other, and we have an opportunity to make some substantial change, some real change. I should have said we are in a time like no other, and we are obligated to make some change. We have the tools that we need. We need the mindset to match. So I'll leave you with these calls to action. Find someone in this room today that you did not come here with today, to this conference. I want you to share your story. We all have a healthcare story. Second, I want you to think of 10 people you can reach out to when you return home. This can be your neighbor, your hairdresser, the local coffee shop owner. I don't care. I really wanted to make it your life mission to get them into this room next time. We aren't kidding when we say your life or theirs can depend on it, and it does depend on it. I want to leave you with this message if you haven't received anything from the last 20 minutes that I've been speaking. To have a healthcare system that works for all of us, we must first believe and organize that it is for all of us. Thank you.
One more time for Darius. One more time. While I get the chills out of my body. So, okay. So what's up next is our time. I mean, we want everybody to talk to each other. And we're going to have a series, we're going to have roundtable discussions. Darius already said, and at a certain point, I would like for folks, as John Lozier said a few years ago, get up and go to a table where you don't know